Hello friends, welcome to Medicine 101. Today we'll talk about the acute pyogenic meningitis. So before going in details of the topic, let's clear some basic terms related to the pathology of the CNS. Okay. So first, we'll talk about the difference in between the meningitis and encephalitis. Meningitis and encephalitis. In the general order, we understand that meningitis means inflammations of the meninges. Meninges what? Basically, we know the three layers that covers the brain. Okay, the meninges that is made up of the inner layer, that is the what? Pyometer, that is related to the surface. Okay, let me draw a little bit of this part over here. For examples, it's not anatomically correct, but for understanding purpose, I am drawing just like this. Okay. So if we see that this is the normal structures, then the inner side, innermost layer will get, that's the dura mater over here. For examples. Okay, so we'll get over this the dura mater over here. And whatever the structures will get after that, we'll get the arachnoid matters. Okay, so we'll get this the arachnoid matters over here. And as I don't have the enough color to show you the dura matters, so let me just show this. Okay. Now try to understand that the innermost layer, what you got over here with the black form, that is the pyometer. Okay. Then we'll get the mid, that is the arachnoid matters, and the outermost, that is the dura matters. Now, from the terms meningitis, we can understand there will be inflammations of the meningitis. But if we just see exactly the inflammations, whenever we are just saying that meningitis, this means only the inflammations of the two layers. Basically, we will get over here the pyometer, I'm writing a pyo, and the arachnoid. So if you see the inflammations of these two layers, that is known as actually the meningitis. Another name for it, that is known as the leptomeningitis. Leptom is the thin layer structure, this is the thin layers. So leptomeningitis we can write over here. Leptomeningitis, okay. Now there can be also the inflammations of the the dural mat, is the outermost. Now for examples, there is any type of the trauma. As a result, we can see there is maybe the, for example, I can write it over here, trauma or some organism that can take place to just get into over here, okay, during the dura mater. And if we see the inflammations of the dura mater, that is known as the patchy meningitis. So what is patchy meningitis? Definitely we need to have idea that patchy meningitis refers to the inflammations of the dura mater. There is also the outermost layer, meningeal layer, okay. If we see or any kind of the inflammations over here, that is known as the patchy meningitis. And for it, the positive agents we can say over here are, let us say, the trauma or maybe some direct interactions of the microorganisms over the layer. Now we need to have an idea what is encephalitis. Now encephalitis, it also defines that definitely it is also inflammations. Okay, so what type of the inflammations? It is the generalized or diffused. Generalized or diffuse inflammations of the parenchymal tissue of the nervous systems. Okay, inflammations of parenchymal tissue, or you can write parenchyma. Definitely of the CNS. Okay, that's the encephalitis. Along with that, there should be more two terms just to be clear for you. One is cerebritis. Okay, let me write it over here. Another term that should be also cleared. Along with that, there is the cerebral abscess. Okay. Now this is also inflammations. Okay, this is also inflammation of the parenchyma. This is also inflammation of the parenchyma. This is also inflammations of the parenchyma. Now, what's the basic differences in between them? So let me write it over here. For example, let me draw. Okay, now if we see that there will be a localized inflammations over here. Okay, cerebritis, there will be localized inflammations over here, but these inflammations that will be non-capsulated, or you can say uncapsulated. Okay, this will be the uncapsulated. But if we talk about the cerebral abscess, whatever thing we'll see over here, that in this case the inflammations that will be just like the capsulated. Okay, that will have a covering. Okay, it's just like the capsulated. It will be capsulated. Okay, and whatever thing we'll see over here, there will be like the pus, because the different types of the inflammatory cells will come over here. Inflammatory cells will come over here, and that will form the pus, because the bacteria will come over here and that can form the structures. But in this case, the cerebritis, we will not see that type of the pus formations. Okay, hope these basic terms are clear for you. Now we'll go over to the meningitis over here. Okay, let me just erase this bottom here. So now if you come over the actual meningitis. The meningitis, I already said you the types. Okay, but you can say the leptomeningitis, you can say also the patchy meningitis. Patchy, whenever it will define the durametry especially, but whenever if we say the leptomeningitis, that is nothing but the inflammations of the pyometer along with the arachnoid matters. Okay, and whenever I am saying the arachnoid matter, definitely we know in these cases that there will be some mesos, just like these structures, where we can see there will be presence of the subarachnoid space, there will be presence of the cerebrospinal fluid. Okay, CSF. So whenever the inflammations will be over here, there can be also inflammations of the CSF as well. Okay, so along with that we can write it over here that the CSF. Okay, because we know that from the anatomical aspect we know that the different types of the structures, the foramina. Okay, now if we just draw just like this. There will be one foramina Monroe, from here it will come over here, and the 420 will come over here. Then we will see this two of the structure further through which the CSF is present. So CSF will get over where? Let me write it here once. CSF will get in the subarachnoid space over here. Then we will get within the ventricles. Okay. Then we can also get within the spinal canal here over also. So there are also chances for the getting inflammation of this particular regions, because the CSF can leak, from these regions to this region. There are various types of the, I already said, the foramen, like the foramen of Monroe. There you will get the lateral, will get the foramen of Blaschka. We will get the foramen of Magendie, through which the CSF can leak out in these regions. So as a result, if we see that leptomeningitis, we can add one more thing over here, that along with the pyometer, arachnoid matter, the CSF. So there can be also inflammations of the CSF also along with these parts. Now, whenever we talk about the meningitis, the first important thing over here that we need to know, there are various types of the meningitis. For positive agents, there may be like the infective meningitis, and then there can be also some other for physical trauma, sometimes of these things. But the most common type of the meningitis, that is definitely the infective meningitis. So it will be the most common type. So the most common type of meningitis, that should be the infective meningitis. Okay. Now we can classify the meningitis. Before going to the classifications, let's talk about the route, through which routes the different types of the bacteria they can take into in the meninges. Okay. So let's write over here the routes through which bacteria will take place within these structures. Okay. So first of all, the first point you have to remember here, the direct implantation. So the direct implantations of the bacteria within these layers. How? If we just look over here, for example, there are some types of some trauma or some chemicals we can see in terms of the drugs. Okay, so whenever there will be some trauma, definitely there will be somewhat breaking of the skull bone. So whenever there will be the broken skull bone will go over here, then from these regions the different types of the bacteria they can go in the meningeal ears. Okay. Now the second types, the second group we can see over here, that's the neighboring tissue. From the neighboring tissue or regions we can see over here. Now how can we classify these things? For example, if I want to show you that, for example, in these regions, okay, in my nose, parasynapse, in these regions there are some types of the pus formations over here. And if I just keep it like this, then whatever the problem will be here, this pus can go through this portion from here, that can go through the type of the vein from here, that can go to the ophthalmic vein from there, it can go to the finally the sinus veins over here. So that can form the, let me write over here, paranasal sinuses. Okay, from here, whatever the things you can see over here. Okay, let me. Then can be different, one type also, this is also important, of stomatitis. There you can also see, there will also breaking of the skull bone, as a result we can see over here. Now, within the direct implantations, we already said about the trauma or the chemical drugs over here. Okay, another type of the thing we can see over here, that is the congenital defect. So congenital defect we can see over here. Whatever the congenital defect we will see, just try to understand from here. Okay, let's suppose there is deficiency of folate, or during pregnancy if we see the neural tube. Okay, if we see the embryological aspect, then there may be also sometimes also chances that the neural tube that is not closed at the proper time, as a result whatever the thing you can see the neural tube that will be opened from the cephalic as well as the caudal part. Okay, so there is also chances to, just like this structure we will see over here, then these types of the fluids, the different types of the proteins, okay, they will come over here, and that can cause the spina bifida. Spina bifida. So here you can also see the spina bifida as a result. Spina bifida is nothing but just like this thing, this vertebral bone in this region, just like the below in these regions. Whatever the thing we will see, this vertebral bone, they will be not able to fuse. As a result, it will be just elevated. Okay. So there is also chances for the bacteria or the different types of the pathogens to go in this from these regions to the spinal cord. Then it can go to the meningeal ears. Okay. Now within the direct implantations, we got two types of the things. There may be the trauma, there may be the chemicals, like the drugs, or we can get the congenital defect. Within the congenital defect, the most classical example we can see over here, the spina bifida. Okay. Now the most important cause related to the roads, that is the circulations. Through the circulations, whatever the structures we'll see. Okay, there's so much within the circulations we know, or we can say the hematogenic factors, for which we'll see the different types of the microbes that will go within the meningeal ears. Now within this structure we can see over here that by some arterial or some venous. Okay. Now if you talk about the arterials, okay, there is a chances for the arterial to carry sometimes of the bacteria, that is just like classical examples we can see here, the pneumonia. Okay, streptococcal pneumonia over here, or there is for example there is a patient who is having like the bronchiectasis. Okay, so this type of the things we can see over here in case of the arterial supply. Okay, now from the circulations these bacteria they can take place over here through the arterioles. Okay, for now let me write it over here, other factors related to the hematogenic. Okay, now if we talk about the arterials, through the artery we already talked about the pneumonia, streptococcal pneumonia or bronchiectasis. Okay, or yes, another type of the thing we can see over here, that is the infective endocarditis. If you see infective endocarditis, within the infective endocarditis we know, if we just see the structures of the valve for example, just like this. Okay, we'll see the multiple vegetations over here. Okay, the different types of the vegetations we get over here, multiple for examples. Now these vegetations are irregular in large, so there is chances for them to get detached from these regions, and through the circulations these vegetations will form the embolisms, and these embolisms that can just go over and deposit within the CMS, and that can cause also the meningitis over there. Okay, so what types of the regions we already talked about the arterial aspect, that is the streptococcal pneumonia in case of pneumonia, in case of bronchiectasis, or in case of embolisms also you can see. Okay, now if you talk about in terms of the venous, let me write it over here. Okay, within the venous drainage you can see the, for examples, let me just show over here. Just like this. Now, for example, is the paranasal sinuses. From here, through the different types of the vein. For example, it will go to the vein of the facial vein. From the facial vein, it will go to the different structures, just like the ophthalmic vein. From there, it will go to the dural sinuses over here, and ultimately it will go to the what in the sinus, the meningeal structures. So that can cause also the meningitis over here. So how many types of the roots we did talk about up to this much? We did talk about cause the direct implantations of the bacteria. Then we did talk about what the neighboring from the neighboring tissues. Then we will talk about the hematogenic, what is the most important cause over here. The other types of the causes we can see over here. From the peripheral nerve. From the peripheral nerves, sometimes, for example, just like this, if we see. Okay, from the peripheral nerve, some under the viruses, that is herpes zoster virus, that can go over there and that can cause also the meningitis in these structures. Okay, apart from the peripheral nerve, that for example, there is a patient who is having the hydrocephalus. The hydrocephalus. So what do you need to do in case of the hydrocephalus? There will be accumulations of the fluid within the cranial structures. Now, if you want to reduce the amount of the fluid over there, then definitely we can do one process for it. So that is the ventricular peritoneal shunt. So, for example, the ventricular peritoneal shunt. What we do in this space is that we just put the instrument over here and we just try to bring the fluid out. Okay, so there is on top of the bacteria that can cause the inflammations over here within the sinus. So from here we can see also the meningitis. You can see also the meningitis. And most classical example for it, that is staph epidermoiditis. Okay. So the staph epidermoiditis that will cause in case of the ventricular peritoneal shunt. In case of the hydrocephalus, you can see over here hydrocephalus. Okay, the accumulations of the fluid in the cranial cavities. Okay. Now we'll talk about that what type of the bacteria or the types of the meningitis you can see. So we talked about the meningitis basically here. Okay, that the leptomeningitis and the patchy meningitis. Now patchy meningitis is very rare. Classically, whenever we just talk in terms of the meningitis, we try to mean the leptomeningitis. Okay. Now within the leptomeningitis, if we see the different types of the classifications over here, we can write that acute pyogenic meningitis first. Acute pyogenic meningitis. Okay. Then we can talk about aseptic meningitis. In most of the cases, these things we can see in case of the virus. Okay, so it can be viral, aseptic. Then you can talk about the chronic meningitis. Okay. Now the chronic meningitis can be seen, okay, in some of the patients more specifically. Okay. So first of all, the tuberculosis. In case of the tuberculosis, okay, so tubercular meningitis we can see in case of the chronic meningitis. Okay. Now we can talk about the spirochetes in case of the syphilis. So in case of the syphilis, we can see also the chronic meningitis, just like the spirochetes. Okay, okay. Then you can see also in case of the cryptococcus, that's the fungal. Okay, so the cryptococcus. So it is basically the fungal. So and this type of thing we can see in case of the HIV positive patients. So it's important. Okay. So the cryptococcus we can see. In the chronic meningitis, we can see also in case of if someone is getting affected in HIV positive by the cryptococcus, then there is a chances to develop the chronic meningitis. So our main topic today is the acute pyogenic meningitis. So I will focus on the acute pyogenic meningitis. Now this acute pyogenic meningitis, it can be seen in the different ages. Okay, we can see in the case of the different ages. So if we just write it over here, acute pyogenic meningitis, we can see over different ages. Okay, and the most important thing on the different ages, we can see the different types of the microorganisms to get involved over there. That's the most important thing. Now we can classify as per the age is concerned. So we can talk about the neonates. Then we can talk about the infants. Then we can talk about the young adult, and we can talk about the old adult. Just we can rewrite like this old. So neonates we will consider in terms of the less than 2 months. Okay. So if we see the less than 2 months, then you can see the neonates. Infants especially will have to consider in terms of up to 1 year. And there are definitely these things, the young adult or old. Okay. No need to say these things over here. Now let me show another part over here. So I'll talk about in case of them right now, the neonates. Okay. Whatever the thing and the complications you can see in case of the neonatal meningitis, and whatever the positive organisms you can see over there. Now if you talk about the neonatal. So neonatal are definitely from where the neonates will get the discharge of the infection, definitely from the mother. So the three types of the organisms we can see over here that can cause the different types of the problem. So for example, okay. What did you say? That's one important. That's the E. coli. Okay, that's good. E. coli. Okay, then we know also the Listeria, monocytogenes, and also we know that Streptococci, beta hemolyticus, Lansfield group B. Lansfield group B. Okay. So if you see in these cases, so these types of the bacteria, the Streptococcus, beta hemolyticus, Lansfield group B, this is the one. In case of the 20 to 30% the women they are having these types of the bacteria within the vaginal structures. And E. coli, it's the gram-negative bacteria that can cause also the E. coli. Now, how the E. coli? For example, we know that the Streptococci beta hemolyticus that can cause, that is found within the vagina, from the vagina whenever the during the delivery time through the birth canal it can get infected within the neonates. Okay, but what about the E. coli? E. coli is not present there. So whatever the thing we'll see, basically from the very basic concept, what do we know? That the IgG antibody that can cross the placenta. So the IgG will get over where within the definitely we will get within the neonates. So after birth, we will get over the IgG. But whenever there will be attack of the E. coli, now just to defend the E. coli, we need the IgM. But during this time, the IgM is not produced enough. Why? The immune systems that is immature yet in case of the neonates. For example, 2 weeks, 3 weeks, just like this. Immune system is not mature enough. We write immature. So as a result, there will be no productions of the IgM antibodies. Just for defend against this, we need also the IgM. So as a result, this neonates can be affected by the E. coli. As a result, we can see developments of the meningitis. Okay. Now the Listeria monocytogenes. This present also where within the vagina. This is also found within the vagina. Now, how will it come over here? Listeria monocytogenes. Basically, you can see this type of the bacteria in case of the undercooked food. For example, so we talk about the hot dogs. Okay, if we see the soft cheese over here, or undercooked food, meat we can see over here. From these structures, whenever the mother they will eat over there, these things, these types of the bacteria will be there from the GI systems. It can go from the GI, it will go to the large intestine. From there, it can go ultimately from here to the vagina. So it will get over there, and it will just form the colonizations over the vagina. So the colonizations in the vaginal structures. So it will be there. Okay. Now, I'll talk about the Streptococcus beta hemolyticus Lancefield group B about this one. Okay, so whatever the thing. Now, if I write it here, the streptococcal, I'm writing it very briefly. Okay, try to understand this. Beta hemolyticus, streptococcal beta hemolyticus Lancefield group B. This not only cause the neonatal meningitis, it can cause also the different dangerous things over here, whatever the things. So you can write it over. It is the most common cause of, first we got over what? We got it already, that it can cause the neonatal meningitis. Okay. So neonatal meningitis. Okay. Second, it can cause what? Pneumonia. Neonatal pneumonia. So what did I say? It can is the most common cause of the neonatal meningitis. Is the most common cause of what? That the pneumonia, or it is the most common cause of the neonatal septicemia. Okay, so you know the septicemia, that means what? Neonatal septicemia. So is the, you can, the stomach over here for this type of the bacteria Streptococcus beta hemolyticus Lancefield group B not only cause the neonatal meningitis, along with that it can cause also the neonatal pneumonia, it can also cause the neonatal septicemia over here. Okay, so for these things, whatever the thing we can do, for example, a patient has come to you, a pregnant woman, around 35 to 37 week of the gestations. Okay, if we see, and if we just suspect the woman that she can have this type of thing, so as a result we are supposed to do the vaginal culture over here, vaginal swab culture definitely. Now if we see this type of the positive test for this, the presence of this bacteria, instantly we need to do one thing. What we are supposed to do over here, that we need to do as a prophylaxis, we can put the penicillin injection. Penicillin injections as a prophylaxis. So prophylaxis. And whenever we do this type of injections, this definitely this bacteria they will get died over here. So there is no chances to get transferred from the mothers to the neonates. Okay, so the neonates will be safe over here. Now we will talk about the infants. Whatever the thing we can see in case of the infants. Okay. Infants means basically we know that from up to 1 year. Okay, so in case of the infants, we can see the meningitis as well. Before, it was seen that in case of the Haemophilus influenzae, not the influenza virus, I'm talking about the bacteria over here, that was causing the meningitis in case of the infants. But whenever the doctors they understood for these reasons, they tried to make contact with the vaccines, so we can write HIV. So they just made this one. So it is available for the developed countries. Okay, in case of the developed countries, the vaccines are available. So they just do the immunizations of the neonates. So as a result, though the neonates of the developed countries or the developed nations, they are safe. But still there are many poor countries. Okay, so who are having the problems. That in case of the poor countries, this immunizations is not possible for all of the neonates. As a result, there is still chances for the neonates to get infected by the Haemophilus influenzae in case of the infants, and that can cause the what? Meningitis. Okay, in case of the infants. So up to 1 year, 2 months to 1 year, you can write it over here. Okay, so Haemophilus influenzae. Sometimes this type of the vaccinations are also given to the mothers. Okay, given to pregnant women, you can write it over here. As a result, okay, against this there will be productions of Ig antibody. Okay, against the vaccinations there will be productions of the Ig antibody, and that through the breastfeeding it will be acquired through the breastfeeding. We can see over here, it will go to the neonates or infants, we can see over here, and that can save the infants from the infections. Okay. Now the other causative organisms related to the infective, the meningitis in case of the infants, on I said already the Haemophilus influenzae. Others we can write streptococcal pneumonia, or you can see is the most common. So it's the most common positive organisms that can cause the meningitis of the infants. In fact, this streptococcal pneumonia that can cause the infections of the meningitis in case of the old age. Now we can see throughout the whole life from the infants, starting from the infants, it can cause the infections or meningitis over here in this topic, that it can cause also meningitis up to the old age. So throughout the whole life it can cause the meningitis over here. The others, okay, so if we just consider the what is the most common organism that can cause the meningitis, we are supposed to say the streptococcal pneumonia. If we just consider the whole life from the neonates, from the infants to the old age, okay, and another that is the Neisseria. Okay. The Neisseria. Especially this thing is found in case of the young adults, but in case of the infants, sometimes you can also see for the Neisseria. It is found especially in case of the young adults. Okay. So the Neisseria, meningitis, or it can also called as Neisseria meningococci. Okay, it can also called as the Neisseria meningococci. That can cause also the the meningitis in case of the infants. But in case of the young, that is the most common cause. Okay. Now I'll talk about in case of the young adult, what type of the organisms will get over here that can cause this type of problems. Now if we write in case of the young adult, in case of the young adult, the most positive organisms over here that will be what, the Neisseria, already said meningitis. So it will be here Neisseria meningitis or Neisseria meningococci. If you want to pronounce in this way, you can also write C like this. Okay. So whatever these things over here, this can go from where it will go. Let's suppose someone is having the problem, okay, when the paranasal sinuses is found over there. Okay, so paranasals from these regions, it can go to the regions. Now, in which type of the countries? For example, there is a room in case of the, for example, hostels, where in a short room, or you can talk about in a small room, more students are living together. So in these cases, we can see in case of the poor country, okay, the people who can't afford to have the different room or separate room for different individuals, they are supposed to live together because they can't afford. As a result, they can cause there also can be development of the Neisseria meningitis. Okay, so in case of, we can say congestions, which the congestions also form. Okay, now one most important thing regarding to this point, that this is very very fatal. This can cause the death within a minutes. Okay, so it can cause within minutes to hours. This is the most fatal thing ever. Okay, you have seen these things here. Okay, if anything is left, we check once if anything is left over here or not. Anything is the first part or the very brief discussions about the pattern, you can consider it as in the next part we'll talk about, the prophylaxis or the treatment or how to manage the patients of the meningitis over here. Okay, so thank you for watching. If you just understand, please do like and press the bell icons to get the notifications first, and let me know in the comment sections if you are having any doubts or if you don't understand any point related to the videos. I'll try my level best to help you guys. Thank you for watching, and don't forget to subscribe. Are you all